Dear friends, happy World Voice Day. I am very honored to be with you today and to celebrate this special day for us, for phoniatricians. Functional dysphonia results from abnormal phonatory modes or vocal behaviors when laryngeal structure is normal. Examples of the vocal behaviors include vocal fatigue, muscle tension dysphonia, functional aphonia, ventricular fold phonation, leading to the hoarseness and even aphonia. Functional dysphonia can be caused by a variety of factors or stimulation following psychological factors or emotional excitement or secondary to organic laryngeal lesions. Long-term or inadequate voice rest can also lead to secondary functional dysphonia. Voice therapy is the main treatment approach for functional dysphonia. Psychotherapy can also assist at the same time. Etiological classifications are different. Parallel classified non-organic voice disorders into phononeuroses like psychogenic aphonia and dysphonia and spasmodic dysphonia, and phonoponosis like hyper or hypokinetic dysphonia. Milutinovic modified this classification by excluding spasmodic dysphonia from the category of phononeuroses for its possible organic background and including in the group mutational disorders, which has an apparent psychosomatic basis. Morrison classified non-organic voice disorders into muscular tension dysphonia, psychogenic dysphonia, and spasmodic dysphonia. And finally, Codby has classified non-organic voice disorders into habitual and psychogenic voice disorders. Dysphonia due to primary psychogenic disorders could be psychogenic dysphonia, psychogenic aphonia, psychogenic superposition, and false mutation. False mutation is known like mutatio falsa, mutatio precox, presbiphonia, sopranino, tenorina, gender change, or mutational falsetto, functional falsetto, persistent falsetto, puberphonia, incomplete mutational adolescent transitional dysphonia, or juvenile voice. Mutational falsetto is when post-adolescent males return their pre-adolescent voice, inappropriate pitch of the voice, extremely inappropriate pitch of the usual voice and speech, high voice in the male gender and low voice in the female gender. Juvenile voice is when post-adolescent women who have the vocal characteristic of a child. In mutational falsetto are men dominantly, 1 in 900,000 cases. It's usually from 11 to 15 years old, and urinal voice is very rare. Etiology of mutational falsetto is primary functional, like mental conflict, oppositional behavior towards an authority figure, and rejection of the role of an adult in adolescent period, regressive shift in psychological development, impossibility of growing up, or an inverse identification with the figure of the opposite sex. It also could be some kind of organic etiology, like muscle dysfunction of unknown etiology and raising the muscle of the larynx due to increased tension. Clinical finding in mutational falsetto: the patient voice is high-pitched, does not correspond to the age, it has a children characteristic, the voice breaks occasionally is deeper, male voice breaks through, mixing chest register and head register, that boys are the head characteristic of shyness, introversion, feminization, and some kind of suffering in their life. Diagnosis for mutational falsetto started with anamnesis, clinical ENT and phoniatric examination, endovidolaryngoscopy stroboscopy, and multidimensional computer voice analysis. Therapy for mutational falsetto is phoniatric treatment, psychotherapeutic treatment, some kind of phonosurgical treatment could be in that patient, and multidisciplinary team is very important: phoniatrician, speech therapist, and psychologist. Our experience with patients with mutational falsetto. In our clinic, we had 60 patients in 10 years. 59 of them were male, aged from 13 to 20 years. The important thing in their anamnesis is they are growing up from mother pregnancy and childbirth, breastfeeding, psychophysical development, success in school, all kinds of activities for music and sport. Their life with parents, with their family, and other problems like allergy or neurology. Patient complaints last from 3 months to 8 years, like variable pitch, instability in the voice, vocal fatigue, a feeling of strain in the voice, squeaky, thin voice, loss of voice, hoarseness, sensation of a foreign body in the throat, and dry cough. We had phoniatric treatment successfully in the first treatment with 30 patients. Unsuccessful were 8 patients. They wasn't motivated for the treatment. Psychological treatment passed 22 patients. Hospitalization were needed for 2 patients, and control group were 30 patients. They came for examination after few months, and we analyzed their voice. And there's some example of a boy with mutational falsetto. And after therapy,
Do, re, mi, fa, sol, la, si, do.
all the voice characteristic before and after therapy was much more better in computer voice analysis. It's proved. And conclusion for the voice mutation is the problem of inappropriate voice pitch is neglected in the field of ENT and pediatric practice. Patients were inadequately treated for a long period of time with the use of numerous and expensive and unnecessary diagnostic procedures. Medical education and research on this problem is needed, and phoniatric team is very important in multidisciplinary approach. Psychogenic dysphonia is often a transitional form of psychogenephonia. Etiological factors are the same, usually occurs gradually or during the recovery period of nephonia. It could be aggravation or benefit with the patients. Stroboscopy finding like elliptic lap or asymmetric vibrations are well known. Psychogenic superposition is a very debatable term. Arise in parallel or subsequently with the organic or functional disorders, could be part of cancerophobia in patients, and psychogenic aphonia, a voice disorder that occurs suddenly as a result of psychological stress. It's most often in women in the second or third decade of their life. Protest reaction to the conflict situation, maladaptive behavior according to type of conversion, neurotic reaction to unfavorable factors, and people who with neurotic characteristics usually without elements of personality disorders. Aphonia is an ability to produce voice. The phenomenon is insufficiently researched. Phonetic and psychological domain is important. Neuropsychological aspect is unexplored. Neurological findings like normal voice but not speech, lack of information among doctors, unnecessary and expensive treatment are used like scanner, and abuse of antibiotics and corticosteroids is unnecessary also. Phonetic findings in the patient. For aphonia, it's known like sparing use of whisper. The findings in the larynx are normal during respiration. There are two forms in the phonation: hypokinetic, non-folding of the glottis, and hyperkinetic, sphincter hyperfunction, spasm of the glottis. Non-verbal forms of phonation are preserved like cough and laugh. In our experience, in our clinic, we had 70 patients with psychogenic aphonia in 10 years period, 61 women and 9 men. For 14 to 75 years old, phonation is established in 84% of women and 78% of men. Psychological support had 58% of patients, psychiatric support 7% of patients. Time until the first phoniatric examination was from 3 days to 61 days. Time to achieve phonation from 1 hour to 2 months, and stable phonation had 83% of our patients. And there's example for psychogenic aphonia in our patient. And cough was good, so voice is here. And after the phoniatric examination and treatment, the voice was better.
Šta se dogodilo danas? Čekajući Petra na stanici, videh jednog starijeg čoveka kako nosi buket cveća. Na glavi imao šešir. Prelazio ulicu naspram one tek renovirane buregđine.
It's also proved with multidimensional computer voice analysis before and after phoniatric treatment. And for therapy, the very important is multidisciplinary approach, phoniatrician, speech therapist, and psychologist, phoniatric treatment, psychotherapeutic treatment, and some kind of phonosurgical treatment could be achieved in that patients. Treatment of psychogenic voice disorders is specific psychotherapeutic and vocal treatment. It depends on the cause that needs to be removed. Methods of establishing phonation for nonverbal forms using nasal phonation with the mouth closed, raising the larynx, relaxation methods. Psychiatric treatment is sometimes counterproductive, and cognitive behavior therapy sometimes is needed. Stress in that patient could be also positive and negative. Women with high level of stress, conflict in interpersonal relationship, responsibility, feeling powerless, without self-confidence, difficulties in expressing emotions, increased musculoskeletal tension. Causes for stress are different from the good one, wedding, childbirth, and the bad one, like quarrel, business, pride problems, tension, and wishes and possibilities. The famous model, Freud model of hysterical conversion, is well known. Tips for the patients are control of the vocal risk factors, vocal proprioceptive awareness, elimination of the mechanism of stress, tension, and muscular stiffness, projection and resonance of the voice, and research into the feeling of freedom and well-being. Functional dysphonia represents a significant health problem if we consider that more than 50% of voice disorders are considered functional. Literature has shown the efficacy of voice therapy for this voice behavior. Systematic review with meta-analysis of randomized clinical trials has shown evidence of voice therapy effectiveness. Clinical experience of patients are resistant to existing common voice therapy approaches. The need for novel approaches continues. Holistic approach to the patient is very important. Success of phoniatric treatment depends on the time that has passed until the first phoniatric examination. Psychological supportive therapy is important. Satisfaction of patients, phoniatricians, and vocal therapists with established voice. Relapses are possible like aggravation, and the story in the professional public ends here or not. And big hello and hug from the Belgrade.